Design is about doing something meaningful for its own sake. How can we make this the best that it can be? Our expectations that healthcare will sort of come to us when we need it makes it kind of like the electrical plug in the wall. It's crucially important, but who talks about it? And when it's in trouble, all of a sudden, it's a huge issue of conversation.
Well, healthcare is broken. You've heard that said over and over again, and we need fresh looks at old problems.
So in 2008, we launched operationally the Center for Innovation.
It's a multidisciplinary team made up of physicians and administrators and designers and project managers and everyone else you can kind of imagine. That group works together to do research and to think about what are the new ideas that we want to be pursuing within healthcare innovation.
Being innovative means you're trying things in a variety of fields.
I envisioned the designers that we recruited as being analogous to the colleagues of mine that worked within my very basic lab.
They've come here because it's an important place to do extraordinarily important things.
I think there's something about Mayo Clinic being a nonprofit that makes them much more willing to share their own challenges.
If you were to talk to anyone at the Mayo Clinic and you were to ask them what the primary value of the institution is, they would all say in almost a cultish fashion,
the needs of the patient come first.
It's a goal we can all congeal around. It makes sense for people.
That tends to breed a certain type of culture because it is different.
Mayo now is well positioned to and equally committed to influencing the future of medicine at the beginning of the 21st century, as our founders were at the beginning of the 20th century.
We have to recognize what a big task this is. This is an evolution that will happen over years, hopefully in directions that we think are much more positive for people and their health.
The mission of the Transform Conference is to try to figure out where to find the new frontiers in practice and method of the nature of health and the nature of healthcare.
The audience is significantly more people from outside of Mayo. There was a real effort to make sure that there were technologists, designers, people from foundations, and broaden the conversation.
I was invited to speak at the Transform Symposium last year, and we've launched an official partnership with Mayo where the Mayo Center for Innovation is sending a team of designers into the clinical sites where Health Leads works to help us better refine and hone our product.
At the end of the day, innovations have to be implemented, or they're just nice visions.
IT technologies, you're going to have data that is actionable information delivered to the point of care.
When you're building a tool for medical professionals or for patients, you have to have kind of an elevated understanding of their experience. Mayo CFI is really one of the only places doing that, so we've learned quite a bit from them.
These are the moments that really matter, our ability to see that we simply can't carry on the way we have been. We have to radically transform the industry.